All right, we're good? All right, so today we're going to go over inflammatory bowel disease. Not necessarily the most fun of topics, but something we really need to know about. Everyone has slides, pens, paper, you're all good? Perfect. All right, so for today's agenda, what we're going to go over is just an intro. I'll give you an intro to me. Some of you have been leafing through that already. I'm going to go over the basics of IBD, and it's two types. I'm going to go over what the usual ways of approach are in terms of IBD, including why they think it happens, and also what the typical treatments are. And I'll go over what the latest research shows in contrast to how it's usually taken care of, and then ways to use that research in order to inform your own diet and health choices. So in 2019, I was just graduating from college. I graduated with degrees in both dietetics and psychology. And I was awarded a research fellowship at the National Institute of Health. I was working in behavioral neuroscience and genomics. So I was, as my mom was so saying earlier, I was kind of very driven in order to be able to, hit my goals and what I wanted to do. And then all of that came screeching to a halt when I was diagnosed with ulcerative colitis in 2020. I was bedbound for 2 years. One of those years was before I even got my diagnosis. It took him a year to diagnose me after I was no longer able to work. And as you can see right there, that's my nice moon face after having been on prednisone for over 8 months. So I've lived it, I've walked it. This was me. So to go through the basics of IBD, I'll start with Crohn's disease. So Crohn's is characterized by the fact that it can happen anywhere in the GI tract, anywhere from your mouth to your anus. It can skip around, so it's not necessarily confined to one spot. Usually you find it in the intestines, but if you find it in one spot, that doesn't mean it's not somewhere else in the GI tract. It also is an inflammation of the entire intestinal wall. So what this means is that from the inside where it touches your food all the way to the outside where it rubs against your other organs, that entire section is inflamed. By contrast, ulcerative colitis is only inside the colon, and it is continuous, which means that if it happens in one area, it'll continue until it stops, and then that's it. It's contained. In my instance, I have ulcerative colitis on my left side. So it starts at the bottom, it goes all the way up to where it begins to bend, and that's where mine stops, and I don't have inflammation anywhere else. In addition, ulcerative colitis is just an ulceration of the inside layer of your intestine. So it doesn't go all the way outside, it just stays on the inside from where it touches food. But then these two have quite a bit in common. They're both autoimmune. They both are characterized by severe abdominal pain, damage to the intestinal walls, usually permanent, persistent diarrhea. This is one of the hallmarks and one of the first clues that they have that you might have IBD. Fatigue and weight loss. Weight loss is the reason for A, because it's so painful for you to eat, but also B, because you can't absorb the nutrients because there's damage going on to your intestines. Right now, there is no definitive cause for IBD. They have hypotheses, they have their various theories, but it is a big unknown, and this usually goes for other types of colitis that go along with it, such as microscopic colitis. There is no cure. There's technically a cure, but it's not a cure that many people want, which is actually removing the intestines. Surgical removal, colectomy, where you have like a bag, that's considered the cure. Let's not even call that plan B, let's call that plan Z. That's way back. So there really is no cure for IBD, but there are new advances closer to the root cause and also into treatment. So the older way of looking at IBD is that, it might have been an overactive immune system, that for some reason that your body was, its immune system was basically a bully looking for a fight. And that's more of a symptom, not really a root cause, but it was one of the ways that they thought this might be happening. Another is genetics. This is actually, still proving to be true. They've found a lot of genes that are involved with the development of IBD, but nothing that they've really pinpointed yet. There's also what they call the hygiene hypothesis. Now, there's two variations of this. One being that because our lives are so clean right now, because we use so much, antibacterial soaps, that, our immune system is almost bored, and so it kind of goes around looking for something to attack. The second hygiene hypothesis that's a little more accurate is that, following that same thing, because things are so clean in what we do, especially eating various things like preservatives and antibiotics, we're throwing off our good bacteria, so we're getting rid of things that actually support us, and for that reason, things are getting all out of whack and causing our immune system to go crazy. And then the last hypothesis they have is just a malfunctioning immune system, that for whatever reason, your body cannot recognize the fact that it is attacking yourself. So treatments to go along with this line of thinking, you have your immunosuppressants. So these can be either broad or targeted. They have various biologics that can focus just on specific parts of the intestine, or things that are much more systemic that go throughout your entire body. These keep your immune system from attacking you, but this also means it keeps your immune system from attacking invaders and other things that mean to hurt you. So in this instance, you are immune compromised. You can't fight off infections as well as you should be able to. And this method can be extremely expensive. I myself am on Remicade. This is a biologic infusion. I get it every 6 weeks, and without insurance, each infusion costs $13,000. It is prohibitive. Thank God I have insurance, because I don't know what I would do without it. The next line of treatment are what they call 5-ASAs. You might recognize this better as the term mesalamine. And these are similar to NSAIDs, but they're considered safe in IBD. NSAIDs are contraindicated for IBD because they can contribute to ulcerations or damage inside the intestine. That's why you hear of people who take a lot of, say, ibuprofen that can get ulcers in their stomach. That's why you don't want to take it. But the 5-ASAs are safe to take during IBD. These lower inflammation throughout the GI tract, kind of similar to taking like an aspirin, as I said, or an ibuprofen, but they're not damaging. But they don't know why they do this. They have theories as to why these drugs work, but they don't really know why these drugs work. And then the last option, as I mentioned before, is surgery. 25 to 45% of ulcerative colitis patients wind up having surgery to remove part of their colon at some time in their life. The younger you are when you're diagnosed, the higher your risk is for this. For Crohn's, it's up to 75% of people. Usually this is due to some form of a complication, such as a stricture throughout the intestine where your food literally cannot pass through. And then the other reason why you might get this done is because of cancer. If you've got IBD, your rates of cancer throughout your GI tract are a lot higher. All of these are, really good at symptom control, but none of them focus on the main issue as to why this is happening, which is where what we know now comes into play. So recent research has indicated that damaged intestinal walls actually precede an IBD diagnosis by years. So before you have a full-blown autoimmune disease, there seems to be some kind of long-term damage that's going on in your intestinal tract. They know that certain foods and diets can trigger this damage. It's been well established. This research has been going on for about 20 years now. And so they know that, if you eat certain things or your diet is a certain way, then it can trigger this type of damage. And we also know that good gut bacteria, also called your microbiome, is important in preventing this damage. Is it not? There we go. To go a little bit, this is going to get a little complicated. If anybody gets confused, if anybody has any questions, please don't hesitate to raise your hand and let me know. So your GI tract is a little bit like a city. You've got your basic infrastructure of your intestines. You've got, the walls, the various things that go along with it. You've got your workers, which take care of it. These can be things like your enzymes that break down the food that you eat so that your body can absorb it. You've got your commuters, which could be considered things like your food, things that come in and then they leave. And then you've also got your own form of a police system, which is the immune system within your GI tract, which mainly comprises of your microbiome. And then all of these work together to ensure that everything is running smoothly. You really can't have it function if one of them's not working properly. I mean, think of it as, if your infrastructure starts to go down because of, of a catastrophic event like a hurricane, now everything in the city grinds to a halt. And the same thing is true of your GI tract. So we're going to take a lot closer look at your GI tract. And what we're going to do is look at it at a cellular level. So what we're looking at here is each of these is an individual cell inside the lining of a typical part of your GI tract. You've got here what are called the villi. And what those do is they absorb your food. You've got a mucus layer, and you've got good bacteria. You've got food particles, and then way down here, you've got the blood flow. So to take a closer look at this, so this would be considered the part of your GI tract that touches your food. So you've got a protective mucus layer. Think of it like your normal mucous membranes, like your nose or your mouth. And with that mucus, it keeps everything nice and smooth, running well. Everything like your bacteria and the food particles kind of rest outside of that mucus layer. And then you've got a layer of good bacteria that kind of helps to cover it. When food is able to get through, it goes to your microvilli, and then those go into the actual cells. Your cells are held together by what are called tight junctions. This keeps them firmly pressed together, and the only thing that can get through is the specific pathways that is meant for food to get absorbed. So in a healthy, gut, they are super close and nothing gets through except what's supposed to. And then at the bottom of that, you've got this blood flow. Now, usually this blood flow goes straight to your liver and then throughout your entire body. So it's super important that everything above that I just mentioned stay healthy. Otherwise, you're going to have a problem in terms of your blood. And so to contrast, this is what it looks like when it's not going well. For those of you who are here for the last talk that we had for lower GI problems, you'll recognize both of these images. But you can see here that the mucus layer has degraded. The tight junctions have also degraded. Things are able to get through, and now you've got stuff inside of your bloodstream. So how does this happen? So harmful foods, what they'll do is they'll come in, they'll harm your good bacteria, and then they themselves will actually create damage. They will cause inflammation. They will erode away at the lining of your intestine. The good bacteria will now get overwhelmed by opportunistic bad bacteria, which cause more damage because the good bacteria actually help your gut regenerate. At this point, your body can't make enough mucus or repair the damage done to its walls very well. This wall breaks down and it begins to let things through. And then things that are supposed to stay inside of your intestines are now inside of your bloodstream. And now your immune system thinks it has a fight on its hands. Now, all of this is supported by research, but in particular, they've proven over and over again that patients with IBD, they have markers for bacteria that are supposed to be inside of the intestine throughout their bloodstream, and the level of bacteria is predictive of how severe their IBD is. So the current hypothesis as to how IBD forms and why is that because the wall is breaking down, letting these things through, and things that are supposed to stay in your intestines aren't staying there anymore, your body is fighting off invaders, and it thinks your GI tract is responsible. So an autoimmune disease, this is a lifelong illness. Whether we know how this damage started or not, this is something that you're going to have for the rest of your life. There is no cure, as I said. Maybe there will be one day, but right now there is not, and there's no indication as to a cure. But we can do everything in our power to reduce the symptoms, reduce the inflammation, so that we can stay in remission longer. So now that I've loaded all the bad news on you as to all this awful damage that can happen, I'm going to give you some take-home strategies as to what you can do to help prevent this. So what you need to do is know what harms your gut wall. This includes things like a low fiber diet. When your diet is low in fiber, your stools get very hard, and these cause actual friction damage to your gut wall. In addition, the bacteria in your gut love to feed on fiber. It's one of their favorite things to munch on. So without it, you're not feeding your good bacteria, and things are getting all out of whack. So ideally, you want to have a diet that's really high in fiber. With IBD, you want to focus on something called soluble fiber. This is the kind of fiber that you find in things like oats and flaxseed. Some of it is, yeah. So I've got flaxseed actually written on the next page. Yeah, I don't have soluble fiber written, but I do have flaxseed written. So what you think of in terms of soluble fiber is fiber that gelatinizes as it gets wet. So that's why I listed like oatmeal. Oh, Metamucil? That's, yep, psyllium. Yes, that is a form of soluble fiber. That's also really good. We'll also be posting this talk on the website. So you'll be able to watch it again at your leisure. That's why I'm wearing this handy dandy little microphone here. Oh, no, you're fine. Honestly, interrupt me anytime you want. I want to make sure that this is all clear. The next thing that you need to know that harms your gut wall is certain food emulsifiers. Now, what an emulsifier is it's a substance that emulsifies fat throughout. So if you think of, for example, like mayonnaise, has a lot of fat in it, but the egg inside of it makes it smooth. The egg inside is an emulsifier, but there are certain emulsifiers that your body not only really hates, but damage the wall, and they create like a slime barrier on the inside of your GI tract that holds the bad bacteria right up against your gut wall, which is the last thing that you want. So these include emulsifiers like carrageenan. Now, carrageenan is a type of seaweed, but you will often find it in any kind of dairy goods. In fact, it's not uncommon if you just get plain old regular cream. There's two ingredients, cream and carrageenan. It emulsifies the fat because otherwise, but way back in the old days, you used to have to shake up the cream that you got, but now it's nice and smooth. That's why. Polysorbates 60 and 80. Same thing. You'll find these in various cream goods, baked goods, pre-done meals, candies. They really kind of sneak up on you. And then cellulose gum, also called carboxymethylcellulose or CMC, usually it's just those two names when you look at an ingredients list. These are super popular, once again, in dairy and baked goods, but you'll also find it in prepared sauces, things like salad dressings. So it's really anything that you suspect might be thickened or smoothed out, it's really important to make sure that these three things are not in there. In particular, carrageenan is actually used in animal studies to induce all sort of colitis-like symptoms so that they can then test drugs on it. So that's the level to which they can cause damage to the GI tract. You also want to avoid certain additives, including titanium dioxide. Now, this is a form of a whitener, really commonly found in various candies or even chewing gum. Really popular in chewing gum. That's what gives it its whitening look. And various studies have shown that when you ingest titanium dioxide, it actually bleaches out your intestines a little bit. So that's one you want to avoid. Artificial sweeteners and sugar alcohols. Now, the artificial sweeteners don't necessarily do damage themselves, but they really throw off your gut bacteria. And when you're already compromised in this area, it's just not a good idea to be doing that further. The sugar alcohols aren't actually bad for you at all. But what they are is they tend to absorb water. So if you've already got issues with going to the bathroom a lot, these can give you the runs really badly, the cramps, all of that. So you'll frequently find these in things that are supposedly like low-calorie sweeteners or, low-calorie, desserts such as, low-calorie ice cream. Halo Top, one of my favorites I used to have, it's in there too. You also want to avoid maltodextrin. This is frequently added to give a much better flavor and mouthfeel to products such as breads and candies, but same thing, throws off your gut bacteria, really not something that you want to be having and can cause the various damage. You also want to avoid high-fat diets. Bummer for us, for anybody who wants to try keto. The reason being is that due to the damage that can happen to your GI tract, your body cannot absorb bile very well. Bile is a substance released from your gallbladder. It's made by your liver in response to a fatty meal. So the bile helps to break apart the fat so that the enzymes can get at it. But when you have a damaged GI tract, your body cannot absorb it very well because it gets absorbed more towards the bottom. And if it can't do that, then you're going to have all kinds of GI symptoms, including diarrhea. So it's not such a great idea. On the second hand of that as well, by eating certain fatty foods, they create substrates that feed bad bacteria within your gut, which isn't necessarily a bad thing if you've already got, plenty of good gut bacteria. But people with IBD, we don't. So you have to be careful of that. You also want to avoid diets high in fructose. This one, the research is a little less clear on as to the why, but its effect is very plain. It also feeds your bad bacteria. In fact, they absolutely seem to adore it. So it's better to just avoid it all the way around instead of, trying to risk it. With fructose, this does not apply to fruit. Have as much fruit as you want. I'm talking about the really high additives such as high fructose corn syrup that you'll find in pre-done foods. Now we've talked about all of the things that hurt you. Let's find out what helps you. So you'll want to eat fermented foods, which are really high in probiotics, the good bacteria. So this can be things like yogurt. You just want to be careful that when you're consuming things like yogurt, that there's not a lot of added sugars into it, because that kind of defeats the purpose. But, this, tempeh, miso paste, all of those are really good things to have. You want to eat foods that are high in prebiotics. Now, prebiotics are the foods that probiotics consume in order to feed them, keep them healthy, keep them robust. These include foods like mushrooms, fruits and vegetables, legumes, berries, and oats. Now, if you've ever talked to your doctor about, the various symptoms you have, you might have heard them recommend to eat a low FODMAP diet. And every single one of those ingredients is on a low FODMAP diet, things you're supposed to avoid. However, if you are consuming plenty of fermented foods, if you're getting your probiotics in, then the substrates from these will all be consumed, feed that, and it won't be so much of a problem, if a problem at all. The issue when you have IBD and IBS, as I said, is that low amount of good bacteria. They're not going to be consuming those substrates, therefore you have an excess, and those can cause problems. You want to be drinking plenty of water. This goes along with consuming fiber. You need a lot of water not only to replenish, put the mucus back inside of your gut and keep your food flowing smoothly. For men, this would be 3.7 liters a day. For women, this is 2.7 liters a day. And for pretty much, most of us who are metric system impaired, that's about 6 16-ounce bottles of water. So each of those is about 16 ounces. It's 500 milliliters. So you want to be consuming almost 6 of those if you're a woman. You want to increase other fiber-rich foods, especially flaxseed. So flaxseed is really high in something called omega-3s, and this is an anti-inflammatory substance. So by consuming flaxseed, you're getting tons of the soluble fiber, but you're also getting those omega-3s, which are calming down the inflammation inside of your GI tract. And you also want to eat plenty of protein, and it does not matter which kind. It can be plant, it can be animal, it can be milk protein, eggs, whichever kind, but you want to make sure that you're eating plenty of protein, because when your body goes through such a level of damage inside your GI tract, it needs the structures in order to build it back up. There's also turmeric and curcumin. Now, you can put these on your food. We also have them available in a supplement form. My personal favorite is something called Inflammable Blocks. It contains curcumin as well as propolis, which is an anti-inflammatory, and it really helps to soothe the GI tract down. Also, as I mentioned, omega-3s. This is super important in terms of anti-inflammation. It also helps your body do various regulations inside. So really important to make sure you're getting enough omega-3s inside of your diet. You really also need to be careful of your potassium-sodium balance. If you've got IBD, you probably have bouts of things like diarrhea where you're losing lots of fluids, or you may not be able to eat as much as you feel comfortable with. But it is really important to ensure that you're replacing your electrolytes and giving your sodium and potassium in the correct balance. So not eating too much sodium, and we need actually a lot of potassium. You'll frequently find it in like fruits and vegetables, even in things like orange juice. So making sure you keep your sodium a little on the lower side and keeping your potassium high will really help in terms of making sure that your body stays as healthy as it can be. So the sodium-potassium balance, you want to be intaking about 4.6 grams of potassium a day. That's 4,600 milligrams. Sodium, you don't want to exceed 2,300. Pedialyte, I know it's high in sodium, a couple of the other electrolytes. I don't know its content of potassium. So potassium's a little bit tricky, actually, to get it in a supplement form in terms of, things added to like Pedialyte. And the reason for that is that if you've got a heart condition, potassium can be really, really bad. That's why frequently people who have high blood pressure, they tell them to avoid diets high in potassium. So the limit is actually 99 milligrams for potassium supplements, but the average person needs 4.6 grams per day. So you really have to get it from your food. So for example, a average glass of orange juice is 400 milligrams of potassium. Banana, avocados, spinach, frozen fruits, so berries. So as long as you're packing in the things actually that I'd already mentioned for your prebiotics, then you're getting lots of potassium, and just don't overload it on the sodium. So also we went over probiotics in terms of food, but a lot of us have to take it in an additional supplement because we have to replace so much of what we're losing. And in that line as well, we also have to replace something called immunoglobulins, also called IgG. These are immune system substances that protect the inside of your gut. And if those aren't there, then your gut's already at a losing battle. So the one that we recommend the most for probiotics is a project called Enterogenic Intensive. We chose this because a lot of studies show that people who have IBD have a much lower amount of the various good bacteria that are inside of this, and by replacing those good bacteria, it helps get them healthy again and keeps them in remission. We also have a product called SBI Protect, which replenishes your immunoglobulins as well. So by taking the two together, you're boosting up your good bacteria, you're boosting up your immune system, and your gut wall has a much higher chance at recovery. We do have them here. Yes, we do. I take both of them, actually. So And then the last one is digestive enzymes. Sometimes because your GI tract is so damaged, we talked about this in terms of a high-fat diet and the bile, it has a much harder time absorbing what it's supposed to. And so sometimes you just need to give it a little bit of an extra edge, particularly with foods you might have an issue with, by assisting it in breaking it down. And we have a product here called OrthoDigestzyme that is good for that. It contains all of the enzymes necessary for breaking down not only carbs, fats, and proteins, but also other things you might have issues with, like gluten. So specifically how we can help is when your gut is experiencing things leaking out into your bloodstream, and the rest of your immune system says, okay, we've got an invader here. When that happens repeatedly with foods, your body can actually develop an immune response to that specific food. It's really common as this might happen with gluten, it might happen with milk, it might happen with eggs. And this is a little bit different from a typical food allergy in terms of it is such a delayed response. With another food allergy, you might consume a food and go right into anaphylaxis or have hives. And this can happen sometimes 2-3 days later, up to 2 weeks later, because it takes your body a little bit of time to go, oh, wait a minute, that's not supposed to be there. And it'll go after it. And that also means you can have the symptoms for a lot longer as well. It can take another up to 2 weeks to clear out of your system. So we do have testing here that can help identify if this is an issue that you've been having, if your body is overreacting to these certain foods, what those foods are, and also give you advice on how to help to avoid them. We also offer something called nutrigenomics testing. This is a genetic test that looks at how you handle certain nutrients. When you have IBD, you can't necessarily absorb particular foods very well, and so that makes it super important that you're not only getting enough, but to know how you process those foods. For example, a lot of the vitamins that we consume in our food are in what they call the inactive form, and our body has to physically activate them in order to use them. If you have an issue with that activation, which is one of those things that this tells us, then you're not only at a disadvantage because of IBD, but now the few nutrients you are getting inside of you, your body can't use very well. So it can be really important to understand how well you're processing and ways that we can help you avoid that. And then we have nutrition counseling. Marty sees people by appointment. I help him out as well. I tend to handle more of the things like weight loss or autoimmune diseases and mental health. He handles things more from a clinical, things like diabetes, high cholesterol, various stuff like that. So what we do in those instances is we look at you as a whole person. We see what exactly is bothering you, what your goals are, and then we meet you where you are. It is not a one size fits all. Every person is different. Every person, goes through this path differently. And so our goal is to make it, the changes that you make to your life as sustainable as possible and to give you as much as your health back as we can. So to use myself as a bit of a case study here, I left off at saying that I was bedbound for almost 2 years. I was very treatment resistant. I failed out of multiple treatments, and I'm actually failing out of the one I'm on now, the Remicade. I came across this research about 5 months ago when I was about to start another immunosuppressant, and this is because I was flaring every 2 weeks before my infusions. You're supposed to get your infusions every 8 weeks. They had to move mine down to 6 because I kept flaring, and then I still kept flaring before. And so they wanted, because I had responded so well at the beginning of my treatment, they wanted to put me on another immunosuppressant to see, okay, how long can we keep you on this before we switch you out? If I failed out of another one, surgery is the next thing on the table. I adopted these changes. I'll be honest, it was a little bit of a Hail Mary because I was in such bad shape. And I came across them completely by accident. It was when I was, reading other research on various types of genetics. It was not something I was taught in my dietetics training. I have a bachelor's in dietetics. It's not something I was taught in my research training. So I'm not sure why this information is not out there, but it's in the various research journals. It's just not being told to people that this is real and that this exists. So I adopted these changes, did almost like a scavenger hunt throughout my kitchen, finding everything that this was in, and it was in a surprising a lot of things. I haven't flared since. That was 5 months ago. I was flaring, every 6 weeks. Haven't flared since. So that's, kind of myself as the walking proof. I'm up here. I'm able to give a talk. I'm not bedbound. I'm, living again. And I've lost 30 pounds since I, ballooned up. I gained 50 pounds on the prednisone. So that was not a fun time. So the really important takeaways for this is that research shows intestinal damage likely due to certain foods and poor gut bacteria can appear years before IBD. And that the current way of thinking is intestinal damage and leaking stuff causes an overactive immune response, and that addressing this damage and preventing it can help reduce inflammation, repair the gut, and help you stay in remission. All right, so thank you all so much for coming. Thank you. We have our next talk actually a month from now. We had all of these gut talks in rapid succession 1 week after another, so we're taking a bit of a break, but we'll be coming back to this on Saturday, August 13th. I'll actually be the one speaking. This brings together my two loves, nutrition and psychology. Does anybody have any questions?